Hi there, Bus Driver Bob here from the Window on the World, and today I'm pissed. Stress in our lives, on ourselves, diminishes our immune system. And believe it or not, I find it very interesting that the modern medical world and their pricing in America can cause a great deal of stress. And therefore, your immune system's down, and therefore you get sick with other things, and therefore you go back and pay them some more. How about that? Something to think about. So I'm pissed today about the billing I've been receiving on some medical care I had this past few months. Now, the website of the hospital or medical facility that I was using, it says right on there they offer a 20% discount to those without insurance. Now, I've been years without insurance, but I've had insurance the last 10 or 12 years or whatever. But doesn't that seem a little crooked? I mean, as an uninsured person, that's a nice little perk, but as an insurance company, that kind of sucks. And then if the insurance company doesn't cover something that they did for you, then that comes out of your pocket. And that's what I'm here today for. So I had some blood work done. I had some issues, and they did some basic blood work, and that was fine. And then I got billed and I went to a doctor, and then they sent me to a hematologist who's a upscale specialist, and you pay them more, and most of those people get at least $250 per visit, some more. He talked to me. He wanted to draw more blood, do more tests, and I went, okay, sure, whatever. They called me back to discuss the results, which basically said, you're fine now. Could have been done at a 5-minute phone call, but I got charged $211 and made an appointment to go in and get that told to me. So right there, you see what's going on. Okay, you follow me so far? Then the lab work they did was quite extensive. I don't know why. I guess they thought I know why. Basically, now that I look back at it, they were just trying to get more money. So they do this lab work. Insurance covered less than half of it. There was one particular service, one particular process for one single lab thing that was done, $386 that I have to pay. The insurance refused to pay it because it doesn't come under what they say. The doctor ordered it, and here's my thing. All right, lawmakers, listen to me, please. American public, listen to me, please. I have long been a supporter of socialized medicine. Don't jump off the yet. Where you all get the same medical treatment, social-wise. If you want more and better, you pay for it. Now, that said, let's look at what's going on here in the medical world. These guys are scammers. They're money grubbing. The American medicine is fantastic what they can do, but boy, they're going to make you pay in and out, and they're going to get you and bring you back for everything they possibly can to bill you. Especially if you have insurance. Poor insurance companies. So anyway, what needs to be done? Listen to me now. And lawmakers, you got to get on this, and people, you got to get on the lawmakers to do this. But those doctors should not order any extra services, lab work, whatever, until they can tell you how much it's going to cost. And if even more so, let you know, be able to find out if your insurance will cover it. Because otherwise, you're just going to pay out the nose. And that's what I've been doing since April. It's now August 1st. I got a notice today that I owe $431 on more lab stuff that my insurance company wouldn't cover. Because a doctor ordered it, saying that he wanted to do it, but he doesn't tell you that it's going to cost an arm and a leg and that it's not going to be covered. There's the problem. So if they're going to do all this stuff, they're going to scam us for their money, they got to at least tell us how much it's going to cost. This is what I want to see go into action. So if you are a lawmaker or you are a patient who's paying through the nose for these people that are raking you over the coals or sucking it out of your wallet, like the American medical health system, that I have never really cared much for because I don't like and trust them. I don't think a lot of them know what they're doing, except they know how to get your money. All right, I'm getting off early, and I'm really worked up because it's wrong. It's very wrong, people. And if you're foolish, if we all let this happen to us, and we all are letting this happen to us, and that's where it's really bad because we are foolish enough to do that. They will suck you in, and they do their game, and they make it all sound important, and then they just take your money, and they keep you coming back. Oh, go see this guy, and go do this, and get this lab, because you think you want to get well. We all want to get well. All they're doing is putting stress on us because we got to pay for this eventually. When we get the bills, then we get stressed out, our immune system goes down, and we're sick again. Get it? It's a vicious circle. Come on, America. We need to fight this. Bus driver Bob from the window on the world, and I am upset. Can you tell?